Welcome to Medical Moments presented by blackdoctor.org. My name is Dr. Keith Crawford. As you are well aware, there's a lot of misinformation about COVID-19 in our communities. And as you're also probably aware, Black people belong to groups that are of highest risk for contracting the coronavirus and also having worse outcomes once infected. As a medical provider, I would like to give you information that will help you and your family stay safe. So, I would like to talk to you about coronavirus testing. We all know that testing is important for our personal health, but it's also important as a public health strategy to protect our communities. Well, how accurate are the tests, and what are we actually measuring when we take a test for the coronavirus? The two basic strategies that we can use to detect the presence of the infection. One, we can either measure the virus directly. Two, we can measure our body's response to the viral infection, which means we are measuring an immune response or the production of antibodies. So let's go with the first option. A virus is a pretty simple organism. It basically has genetic material and certain types of proteins that we may refer to as antigens. And so we can measure both of these. If we measure the genetic material, we use a strategy called PCR, or polymerase chain reaction. This is the most sensitive and the most accurate way to detect the virus's genetic material. However, it generally takes a little bit longer to get the results, and the test may have to be done in a laboratory setting. The other thing we need to be aware of is it may take up to a week after a person is actually infected before we are able to detect the viral genetic material in a nasal pharyngeal swab. The next thing we can measure are viral proteins, or the antigen tests. The advantage of these antigen tests is that they are much simpler than PCR and can often give us results much more quickly. However, these tests are less sensitive and less accurate. So, we often make a trade-off between accuracy and precision in order to save time. The second type of test that we talked about is measuring the body's response to the infection. We can measure the production of coronavirus antibodies in our own body, which is the way our body fights off the infection. We don't use these types of tests to tell us whether we're actually infected, but we can use these antibody tests to say that we have been exposed to coronavirus and have recovered from the infection. So these antibody tests may be helpful in telling us that it is safe for us to go back to work. We're protected from the coronavirus, and hopefully we were not able to infect other people. So what do you do in the meantime? From the time you request your test to the time that you get the results back, you should quarantine. Limit your contact with other people, wear masks, practice social distancing. But as we just mentioned, getting a negative test is no guarantee, because all of these tests take time before we can detect the presence of the infection. So if you get a test and it comes back negative, and later on you develop symptoms, and you don't feel well, contact your medical provider and have a test repeated or go in and be seen by a medical provider. So these are some simple tips, and if you have questions about testing for the coronavirus, be sure to talk to a licensed medical provider or talk to your local Department of Health. Thank you very much for listening. Please share the information that you received, and we have to really work hard to fight the misinformation in our communities. Thanks again.